Another case where we can use the tool is I was at the NCCN meeting back in March, and I attended a small session they call a fishbowl on use of AI in oncology. It was a very interesting session with a lot of people, and everybody complained a lot how they could have used AI for this or for that, and they wish there would be just a magic button and AI could fix all of their problems. And then actually our lead of the session says, well, I just wish I could have a tool which gives me the right treatment for my patients, because I cannot remember every treatment for every mutation and it changes daily. I just want to know if I tested my patient as a PIK3 positive, what's the therapy as of today? Well, I will answer that specific question. So in metastatic, we are still on a HER2 negative right now. And in this case, the patient tested for PIK3 activating mutations and is, as I've mentioned in my previous short video, in this case, this usually is the patient that has been treated already with first-line CDK4/6 inhibitor. And so we're going to look at the patients who progressed on the CDK4/6 inhibitor on the standard of care. And that patient has the mutation. So in this case, what are the best treatments? We have 2 drugs here, potentially 2 targeted therapies that are appropriate in this case. And if you want to know more and see this specific references for these specific treatments, there are 5 studies. You could explore the results and see the studies right there on the screen. So you start on top, of course, with those treatments that we are considering category 1 based on our review of multiple national guidelines that are also listed in ASCO guidelines. And you could look at the label for these treatments, but also if you scroll down, you will see some newer evidence, some newer upcoming phase 1 studies, so that you know what's new is coming. But there are multiple options right now with, as you could see here, there's 3 studies total. You are able to review the progression-free survival, and overall survival was not reported in any of the studies. So if you're one of the researchers in the academic institution and you want to just update yourself and you have a fast question, well, did any of this treatment reported overall survival? That's not going to require you hours of searching and conducting a systematic literature review on your own or assigning your PhD student to do that. It requires exactly less than a minute to click this and see whether the overall survival benefit has been reported by any of them, even though these were phase 3, 2 of those are phase 3 RCTs. Going back, if the patient has another mutation that is recommended to be tested by the guidelines, which is ESR1 mutation, again, exactly, if as long as the patient is not in visceral crisis, if the patient progressed on a CDK4/6 inhibitor therapy, as you could see here, that in this case, the only option is the estrogen therapy, but there are several options. There are options that are described in the guidelines, as well as the options right here in green that are not yet in the guidelines and may be helpful for your patients. So let's look at those options. So if I go for endocrine therapy right here and explore the results, I could see the option for one therapy that, based on the Emerald trial, that is recommended by the guideline. But then here are the 2 other phase 3 randomized control studies that reported results already, and that potentially will be added to the list of options you could use for your patients. And considering that the safety profiles of these could be different, you may want to look at them and consider them in case that these are the options you may want to take with your patients.